Save me one, we'll still be friends. Hey, I'm sitting down and I'm talking with Cory Page, a pharmacist from Utah Valley Regional Medical Center, and today we're talking about diabetes. We're having a telethon throughout the day asking the experts so people can call in with their questions, but we want to specifically talk to you about medication, and there's a lot of stuff that is really helping us understand diabetes more, understand the way to keep it in bay and control it. So let's talk about some of the medicines out there.
Okay. It's an interesting thing because diabetes is one of the few disease states where there are a lot of medications coming into the market.
Okay.
The old standbys are still there, but there's a lot of research being done. Currently in diabetes there are 13 classes of medications, not including insulin, that can treat diabetes.
And what are some of those medicines?
So some of the medications, I've got some up here in front of me. Victoza is one of the newer classes of medications. There's actually 3. Victoza is just one that I brought. And they actually work in the intestinal tract.
Okay.
Help to change the way that your body absorbs glucose and metabolizes it.
For someone out there that might not understand diabetes, and me being one of them, what is diabetes?
So diabetes, there's 2 types. Type 1 is an autoimmune disorder where your body attacks the insulin-producing cells of the pancreas.
Okay.
Type 2 is a downregulation of how the body uses insulin within itself.
Is there one that's more common than the other?
So type 2 diabetes is the most common. It's primarily a disease that comes, or a condition that comes forward in the adult age of life. However, we are seeing more and more people that are older in age receiving type 1 diabetes as well. So it's important that you find out, first of all, what you've got.
Okay.
Because the treatment options are completely different. If you have type 1 diabetes, insulin is your option. If you don't, you've got a plethora of things that your physician can find that works for you. And
you've got a lot of tools out there to help you manage your diabetes, such as this right here.
Yeah, so this is an insulin pump, and it's one of several. Again, I didn't bring them all with me, but it changes the way that we give ourselves insulin. A person will place this on their skin, and it has a catheter, much like an IV, that's subcutaneously planted. It continuously gives us insulin, and then when we eat, based on the carbohydrates and where our blood sugar's at, we'll also calculate doses of insulin.
And this would take place over the daily shots that a lot of people are used to.
Yep. I wear an insulin pump as well, but I still have to give myself insulin. It just changes how fast I can do that, and the minimal amounts of insulin that are required. This insulin pump can deliver 0.025 of a unit of insulin.
And sometimes you'll need that much.
And sometimes I do. Yeah, as opposed to waiting until I'm 40 points high and I give myself a full unit.
Okay, and what is this right here?
So this is just a representation of how quickly diabetes is progressing in the United States. You can see that on the top it's obesity. As our societies become more obese, it directly correlates with the prevalence of diabetes. They're directly correlated. And so lifestyle is a big issue.
So the sooner you can get a handle of your diabetes, the better.
Exactly.
All right, so if people have got questions today, there's going to be a number at the bottom of your screen. Feel free to call with any and all your diabetes questions. We'd love to help you if we can. If people want more information, where can they go for you?
They can contact me at cory.page@imail.org. Shoot me an email. I'd be glad to call them back.
And technology is really helping us get a hold of this.
I think the most important thing for people to understand is they need to be involved in their care. That they need to be in constant communication with their physician and recognizing that it needs change.
All right. Thank you very much. We appreciate it. Stick around. More Fresh 7 will be right back.